Hello. This short webinar is to support eCQM measure selection and reporting options for program year 2025. I'm Jolene Riney. I'm Manager of Quality and Population Health Data at Contexture. In today's webinar, we will discuss Contexture's partnership with the Colorado Department of Healthcare Policy and Financing, or HCPF, review roles and responsibilities, discuss electronic clinical quality measures to help practices be successful in the Health First Colorado alternative payment model, and outline how practices can work with Contexture. Contexture, now affiliated with QHN, is supported by the Colorado Department of Healthcare Policy and Financing as part of an overall initiative funded by CMS, which allows Contexture to provide no-cost support for PCMPs, or primary care medical providers, who wish to connect to Contexture. Costs are typically covered for practices reporting electronic clinical quality measures, or eCQMs, through Contexture, and Contexture is able to provide support and technical resources to minimize administrative burden on practices. Contexture's quality improvement team partners closely with the RAISE to provide support for the alternative payment model. For the APM program, practices will select 10 total measures, which are a mix of structural, administrative, and eCQMs. The RAISE are responsible for structural measure support and assistance with administrative or claims measures. Contexture's quality improvement team is responsible for supporting eCQM reporting for connected practices, reporting their eCQM data electronically or using a hybrid reporting method. CCMCN is responsible for collecting and reporting eCQM data for manual reporters who are unable to connect or do not wish to connect with Contexture. Structural measures focus on capacity and system processes and include things like alternative encounter types, patient satisfaction, and behavioral health integration. Administrative measures were formerly known as claims measures. These measures are calculated from claims data that is submitted for Health First Colorado members. Examples of administrative measures include child and adolescent WellCare visits. eCQMs are measures calculated from a practice's EHR or CCD, continuity of care document, data sent to Contexture from the EHR vendor that reflect health services or interventions being provided. In order for data to be reportable, it has to be documented in structured data fields. Free texting does not meet measure requirements. eCQMs include the entire patient population for the practice. So any patient that has been seen in the practice for a qualifying encounter during the measurement period and meets measure criteria. Examples of eCQMs include screening for depression and follow-up plan or controlling high blood pressure. It is important to note that HCPF does require PCMPs to report additional eCQM data specific to their Health First Colorado patient population. This means that when it is time to report data, practices will report two data sets for their eCQMs, their entire patient population and their Health First Colorado patient population for each measure selected. Some EHR vendors do not have the capability to report eCQM data by payer, but Contexture is able to assist with reporting both sets of data for those practices that connect to us to send CCDs. Scoring for the APM program in 2025 is based on eCQM data for the entire patient population. Practices that elect to send their CCDs or continuity of care documents to Contexture can utilize the electronic reporting solution, meaning the quality improvement team utilizes the CCDs to extract eCQM data, validate the eCQM data, and work with the practice and their EHR vendor to improve the accuracy of their data. Practices who choose not to connect or cannot connect due to EHR vendor limitations will be identified as manual reporters. This means that when it is time to submit data to HCPF, they will be responsible for providing numerator, denominator, and performance rate data to CCMCN for each of their eCQMs. Data validation is completed for each practice that is connected to Contexture and each measure the practice has selected to ensure accuracy of data, following strict adherence to the measure value set. Data is validated for data completeness, inclusiveness in the CCD, and correct codes to meet measure specifications. In this example of validation for the controlling high blood pressure quality measure, the screenshot in the lower right shows the eligible encounter, a 99214, and diagnosis of hypertension, which places the patient in the denominator, and the blood pressure below 140/90, which places the patient in the numerator. Utilizing the electronic reporting solution by sending CCDs to Contexture and reporting electronic data does allow practices to receive technical assistance from the quality improvement team. The QI team will also provide quarterly reports to show performance trends and quarterly care gap reports, which can be useful for patient recalls. Electronic reporting ensures that practices are adhering to the measure guidelines and decreases administrative burden on the practice. Practices should connect with Contexture as soon as possible. The timeline to report for program year 2025 is between January and March of 2026. 2024 baseline data can be reported at any time during calendar year 2025. It is important to connect early in the year so Contexture quality improvement advisors are able to review measure workflows so the data reflects what is being done in practice, and so the practice is able to receive quarterly care gap reports to utilize for patient recalls. A PCMP is eligible to receive the full point value for an eCQM if they report baseline 2024 and program year 2025 data with at least 20 patients in the denominator for both years and demonstrate close the gap improvement of at least 10% from baseline, or if they report data for program year 2025 with at least 20 patients in the denominator and achieve HCPF's statewide goal for the measure. It's important to select measures that have at least 20 patients in the denominator. PCMPs can earn between 50% and the full point value for an eCQM if they report baseline and program year data and demonstrate close the gap improvement between 5 and 10%. PCMPs can earn 50% of the maximum possible points for an eCQM as long as there is at least one patient in the denominator, regardless of the performance rate. If a PCMP has a denominator size of 0 for an eCQM, they will earn 0 points for that measure. When selecting measures in program year 2025, it is important to understand the measure definitions for each of the eCQMs, which we will review in more detail later. Research which measures are available to you through your electronic reporting or through your EHR vendor. Do you work on quality metrics through other programs? To ease burden, it can be beneficial to align measure selections with these other programs whenever possible. If the measures are not available through a report, understand how you would need to pull that data. It is also helpful to understand your current performance if you have measure data available in your EHR or through Contexture if you're already connected. Consideration should also be given to the denominator size. If you have a denominator size of 30 or more patients, it may be valuable to select that measure to set yourself up for success in ACC Phase 3. These are the clinical quality measure sets identified by HCPF for program year 2025. Those measures that have been identified as mandatory measures are indicated on the slide. It's important to note that the pediatric measure set only has 3 eCQMs available for selection this program year, with the rest of the measures being administrative measures. So talking through each of the eCQM definitions, we will start with depression screening and follow-up. This is one of the mandatory measures for both pediatrics and adults. This measure looks at the percentage of patients 12 and older screened for depression on the date of the encounter or 14 days prior. Positive or negative value needs to be delineated and documented in a discrete data field. Positive value and negative value each have a separate code that identifies the screening outcome and is required to meet measure specifications. If a patient screens positive, a follow-up plan needs to be documented in a discrete data field using proper codes contained within the value set for this measure. Follow-up can be returning to the practice if symptoms worsen, provider in-house counseling or education, referral out to counseling, or prescribing a medication. It should be noted that patients with an active diagnosis of bipolar disorder will be excluded from this measure. Patient or parent refusal is no longer an exception for this measure. Contexture adheres to the value sets which are set forth by the Value Set Authority Center. Each eCQM value set contains the specific data elements and codes that are required to meet the measure. Free texting within a progress note will not meet measure criteria. The next measure is childhood immunizations. This measure is specifically looking at children who turned 2 years of age during the measurement period and who had recommended vaccinations completed by their second birthday. It is important to note that historical vaccines received at another office or birth hepatitis B vaccine administered in the hospital should be reconciled within your EHR system utilizing the correct CVX codes. Patients who receive the recommended vaccines after their second birthday are not considered compliant with this measure. This measure was previously called diabetes hemoglobin A1C poor control. The new measure name is glycemic status for patients with diabetes, but the measure definition has not changed for this. This measure can be a little confusing as it is an inverse measure, meaning a lower performance rate is better. The measure is looking at the percentage of patients 18 to 75 years of age with a diagnosis of diabetes who had a hemoglobin A1C greater than 9% or no documented hemoglobin A1C result during the measurement period. Lab values from an outside source or received as a document need to be added to the EHR in a discrete field associated with a low-int code add-in encounter. Faxed or scanned-in results will not satisfy this measure. In-house labs also need to be associated with the correct low-int code to satisfy the measure. The cervical cancer screening measure is looking for those women 24 to 64 years of age who were screened for cervical cancer. Success will be dependent on the low-int code provided by the lab in the result. Faxed or scanned-in results will not satisfy this measure, and the screenings must be ordered and resulted and documented in a discrete field. Breast cancer screening is measuring the percentage of women 50 to 75 years of age with one or more mammograms during the measurement period or the 15 months prior to the measurement period, so a mammogram after October 1st, 2023 for program year 2025. Diagnostic imaging from an outside source or received as a document should be added to the EHR in a discrete data field utilizing proper codes from the value set. Ordering breast cancer screening alone does not satisfy this measure. The screening has to be completed and resulted in order to satisfy the measure. Colorectal cancer screening is measuring the percentage of patients 45 to 75 years of age who had an appropriate screening documented for colorectal cancer. Diagnostic imaging or lab results from an outside source or received as a document should be added to your EHR in a discrete data field using proper codes from the value set. Ordering colorectal cancer screening alone does not satisfy this measure. The screening has to be completed and resulted in order to satisfy the measure. Chlamydia screening for women includes women 16 to 24 years of age who are sexually active and who had a visit during the measurement period. It's important to note that for the purpose of this measure definition, sexually active is defined by codes related to pregnancy, sexually transmitted infections, contraceptives, and infertility treatments. The measure logic will also look to ensure the screening was ordered and that the order returned a result. Low-int codes may need to be updated with your lab partner so that the correct codes are added to your EHR. Controlling high blood pressure includes patients 18 to 85 years of age with a diagnosis of essential hypertension starting before and continuing into the measurement period, or starting during the first 6 months of the measurement period. Patients diagnosed with hypertension during the last 6 months of the measurement period will not be included in the denominator. The numerator does require both the systolic to be below 140 and the diastolic to be below 90. If no blood pressure is recorded, it is assumed the patient's blood pressure is not controlled. If you have any questions about connecting to Contexture, eCQMs, or need measure selection support, please reach out to your QI advisor or email qi@contexture.org. Thank you for your time today.